Today we will speak health aspect and social role women in diabetes. When I start thinking what I can deliver, because it's not specific topic like something, but I would like express my worry how many problem we have with this area, and it's very important that we not speak in women days specific, that it's a lot of attention for different problem, because women health is very important every day, and a lot of problem. We start health aspect. 2 of every 5 women with diabetes are reproductive age. This is case is keywords. We must care about them. And women with type 1 and are at 40 high risk in premature death, and they are male contemporaries. Sorry. Women with type 2 have a 27 increased risk of stroke and 44 increased excess risk to coronary heart disease than their male, and then we will speak about this later. Women with diabetes are 4 times more likely to suffer a stroke than women with without diabetes. Women type 1 diabetes have an increased risk of early miscarriage, and 1 in 7 births is affected by gestational diabetes. Compared to men, women are also at great risk of blindness due to diabetic retinopathy. Elderly women with type 2 diabetes and stage renal disease have a significantly higher risk of death than men with similar problem, and women also consistently more likely to develop depression than men. And of course, why there's a lot of problem? Why they have more risk than men? Because of course, some biological issue factor linking to the sex difference, but mostly that's a lot of barrier linking to health system delivery and health seeking behavior, as well as psychological factor, other factor linking to the social economic determination of health. As I say, diabetes is severe and neglected treat to material and child health. Over half the women who experience gestational diabetes go to develop type 2 diabetes. Everybody know. And gestational diabetes increase pregnancy-related complications such as high blood pressure, large birth weight, babies, and obstructed labor. Pregnancies in women living with diabetes can worsen pre-existing diabetic retinopathy, leading to significant visual impairment, as well as women pre-existing kidney disease. And you see, menstrual cycles, menopause, and pregnancy can make a difference to manage blood glucose level. And we have a lot of conference, but not very often speak about this specific problem. I would like start from some attention for earlier diagnosis, what we must do. And of course, we know exactly symptoms of for diagnosis of diabetes, but we have also some unique symptoms which could be characteristic for women. This is vaginal itching and pain, as well as vaginal infection. This is case, it's we must every doctor who have this problem with patient have this problem, must attention of this problem that could be diabetes. Please check your level, blood sugar level, urine tract infection, decrease a sex drive, and also polycystic oval syndrome. This is very important to know to every doctor. And also we must use our other health professional. My students with pharmacists no, I will teach them that if somebody come to you and ask about some treat like original itching and pain, ask them, do you know about your status with diabetes? And this case, it's we need involved and use every healthcare professional who can help earlier diagnostic diabetes and send to doctor. Pay attention for this. Go to doctor and check blood. And we know that gestational diabetes is one of the most common complications of pregnancy. And if you see, it carry a long-term risk of type 2 diabetes mellitus and other complication for both mother and baby. Previous gestational diabetes, you know this, an 8 or 10-fold high risk of type 2 diabetes where it is no without gestation. This is why IDF pay attention and make act. Last year, and also start, but this year we implement this, and also in our Congress, special action, our women committee, which I also was part, that about this risk of type 2 diabetes and then very important pay attention for women who after their postpartum issue, women who miss their postnatal follow-up are higher risk development cardiovascular disease. A meta-analysis show that over 5 million women pointed out of twofold higher risk of cardiovascular disease versus women without diabetes. And this is urgent need for early and ongoing proactive surveillance and effective prevention strategies for type 2 diabetes and cardiovascular disease. And how to importance adherence and screening. In diabetes screening is linked to child vaccination program and family planning visit. And this is issue in health and virtual visits increase rate, for example, you see in India. Pregnancy as an opportunity to prevent type 2 diabetes. If you see, look, guideline, best practice advice, improve postpartum follow-up rates, but coordinated postnatal care supported by case manager of healthcare worker, reduce waiting times, clear communication about health, practical guidelines and nutrition and lifestyle vaccination and baby care program, using reminder system, implementing encouraging home self-testing. This is important because you know when women had baby, got baby, they a lot of attention to baby, not herself, and this is important. Be with her and pay attention for some risk and really an earlier diagnosis. If you look life course risk for type 2 diabetes of other not communicable disease, you see some stage which we must have intervention in every stage. And my attention postpartum, where it's a lot of could be risk, but woman cannot recognize or recognize too late. And you also see how few steps we must put attention, like planned pregnancy. I will speak about this later. Detect gestational diabetes earlier as possible and reclassify postpartum and intervene. What we must do if we earlier diagnosis diabetes, if it's pre-diabetes, how we can lifestyle intervention, how it's normal, is great, but anyway it could be prolonged risk and we must diagnose this on every stage and help this woman, help to woman. Why are women with diabetes high risk of poor heart health? Diabetic cardiomyopathy is a potential contribution that affect women more than men. Coronary artery disease increase among women with diabetes, but it cannot explain the increased risk of heart failure. A biological difference is effect of diabetes and cardiac function in women compared to men has been noted, especially among women with type 1 diabetes. The loss of diastolic function has a great determinate effect on family heart compared to men. And of course, hormonal changes also play a role. If you look heart failure among women with diabetes, it's more big risk, and that is increase was independent on confounding factors even. You see, this is people with diabetes or without is high risk. Another problem which I would like to pay attention, which we also not very often speak about this, it contraception for women with diabetes. As doctor, you know that we must plan in this pregnancy, and we must thinking about how we prepare for pregnancy. But contraception is one way which we can um, not have a pregnancy suddenly, for example. And I look a lot of researchers, and it's for me it was surprised that not many women care about this, and not many women know about this deeply, how it could be risk for not planning a pregnancy. And then you see lack understanding of risk and less likely to be using contraception than women without even diabetes. You see lack understanding about high risk for unplanned pregnancy. Two-thirds of pregnant women were not able to remember discussing pregnancy contraception with healthcare provider. This is our fault that we as healthcare professional not speak about this. It's not like very important. Those having had a pregnancy exhibited no additional knowledge regarding risk associated with pregnancy and diabetes. And also, women were found to have difficult complying with contraceptive advice, and the majority were not using reliable contraception prior to became pregnancy. This case, we must educated. We know that World Health Organization had developed medical legally criteria to guide contraception choice, and we must say to women that women with diabetes without complication has choose from the full range on contraceptive methods, include hormonal contraception as the advantages of use overweight any risk. Women with diabetes complication may need specific advice to access to the high-risk benefit evaluation equation, particularly in respect of hormonal contraception. I would like ask you, do we educate doctor for this, for different contraception? Can they advise, really give really advice to this problem? To be honest, I think we have a big gap of this. Women should be aware that there is no restriction to use of oral and intrauterine emergency contraception method. Challenges, as I say, lack understanding about risk. Women have difficult complying, and the important educate women with diabetes from all group of society. This is we must do. The challenges is supported women with type 2, type 1 diabetes in making choice of contraception, but based on the individual needs and associated risk factor. This case, and this is what very important, young people with unstable diabetes are a particular concern as they need reliable contraception because they have this in order to prevent high risk initiated pregnancy. And another, this is from my side, it's very important and big gaps in knowledge and awareness about this. But what is also our real problem, this is accessing to diabetes care. And a lot of research show that women have less and difficult women faced more difficult in accessing, for example, type 2 diabetes, and faced women faced personal, social, cultural, health, system, economical, psychological, and geographical barrier in accessing type 2 diabetes. And also, I would like to pay attention on stigmatization and discrimination faced by people with diabetes, particularly pronounced for girls and women who carry about double burden of discrimination. This is I hate, this is I fight, because we cannot put blame people with diabetes and special girls they have diabetes they cannot pregnancy, a lot of misunderstanding, a lot of lack awareness about real situation, and this is our girls and young women feeling stigmatization and discrimination, and also lack of education restrict access to information, restriction to free movement, well, and of diagnosis with diabetes. This is, I would like to attention, they are not as good at treating women. We know this. But this is, it's consistent. This is, we must change, we must destroy this barrier for our women. And for end it to what we can have strategy, the development and specific approach to diabetes prevention, education, and care for women and girls. But I would like pay attention. Everybody say that we must awareness and educated women with diabetes. But please, men, also responsible. Do you want? I'm sure that you want that your woman, your children, girls be healthy forever. And it's also your responsibility. And also, we must educate all family and also men who can help to us change this situation. Equitable access to care, irrespective of gender, an increase in awareness of the disparities of access and outcome among policymakers and healthcare professionals, more research into their sex and gender specific disparities in diabetes health and outcome. It's but this is strategy, but we must implement this in real practice. And of course, this is, I will soon will change. I see that it my time finish. And health among adults are largely due to behavior initiated during adults. We know exactly that women and girls are key agent in the adoption of health lifestyle. This is spoke my colleagues before, and but we must help women to do this. We must give to them some instrument for do this, not only put a responsibility. We must give instruments for do this. And few face need to health system. What I would like I could do to promoting opportunities of physical exercise. This is also important. Give to them choice, give to him them right choice, and have access to physical exercise. What we need to do in order to minimize complications, safe, effective contraception to prevent unplanned pregnancy, monitoring and improving material health within encourage adequate inter-pregnancy specific and use the effective contraception form integral part of the pregnancy care. In this case, it's a lot of we must to do increase public awareness, specifically of women, media, in another healthcare professional, education of patient, but education of doctor also, and not only endocrinologist, family doctor, and another doctor who another specialized psychological support of family with child with diabetes. We speak about women who care about children with diabetes in family. This is mostly in mom, and sometimes it's even father leave family. And in this case, it's very important give support this family, support woman who has child with diabetes. And of course, help to them, as I say, how they can change lifestyle behavior and their member of family. Not on, we cannot only recommend, we must help to do this. This is it's my speech to reflect, to think, and to act. Thank you so much.